Hey guys, sorry that video got cut off. I'm using this sort of free video recorder thing that only records like 10 minutes of video at a time. So I'll try and keep these short. I think I can get it done in about one or two more, maybe. Hopefully, we'll see. But yeah, I was just saying this kind of reaction happens in the exact reverse within the red blood cell and the lungs to produce this CO2, which then is breathed out. But enough about that. Scroll back up here to this page, and so we can kind of refer back to it. Uh, yeah, make it easy for ourselves when we do some problems. Anyways, so when they give us these blood gas problems, they'll usually kind of say, a patient is admitted to the ER with such and such symptoms. The blood gas measurements were drawn, and these are the results. They'll pretty much give us the pH, the PCO2, the bicarbonate, and sometimes they'll give us the PO2 and maybe like the dissolved carbon dioxide. But I think for most of these problems, like the blood gas problems, all we really need uh, is going to be these three values here. So I think those other two, if they give us any of them, are just kind of extra information. So mainly just kind of pay attention to these three. And so we can kind of see them here. You can draw it out if you want, keep it simple, and just kind of look at the pH first, then the PCO2, then the bicarbonate. And kind of how we do that, you can draw it out. pH, it's 7.16. So we look over here at our reference range, that's below 7.35. So we know it's low. Oops. It's going to be acidosis by our scale. And so, boom, right there, you already kind of have a quarter or like half of the problem out of the way because we know it's acidosis. And then, so looking at the PCO2, that's going to be 69. Look back over here at the reference range, that's elevated. Draw that in. The bicarbonate, that's 23. Look over here at our reference range, and that is normal. So we'll just mark it down as normal. And now we have to decide, whether it's respiratory or metabolic. And that's when these rules come into play. They kind of make it pretty easy if you just look at this and remember that respiratory disorders are opposite, metabolic disorders are equal. And so what that means is, which of these, fits the situation? Well, here CO2 goes opposite of pH. The pH is decreased, but the PCO2 is increased. So they're opposite. That means it's respiratory acidosis. Um, and it is kind of as simple as that. There's no compensation going on in this problem. The first one out of the gate, just trying to keep it simple. But if you kind of follow these steps and then look at, which way these values are going, look back at the rules, it should give you kind of half of the answer, right off the bat. Um, Usually the second half of the question is kind of when they ask us, okay, well, what's going on? Why is this happening? Well, you got to think about it. The pH is acidic because the lungs, it's a respiratory problem. So the lungs aren't blowing off enough carbon dioxide, or they can't. So they're retaining that acid component and decreasing the pH. And this can happen, in their case study or whatever, possibly like with a sleep apnea or COPD patient who can't breathe well, or maybe like an abuse of benzodiazepine, Valium. Those drugs kind of work to, I think like decrease heart and respiration rate. So those are some of the kind of things that you can think about when you get these problems. But just remember to map it out and kind of use these rules. But we'll go on to the next one. Again, pH, then CO2 and bicarb. We'll look at them. The pH, 7.61. We'll look over here at our scale. It's elevated. We already know it's alkalosis, judging by that. 2, the PCO2, well, it's 26. Our reference range, it's low. The bicarb, looking over here, it's 25. Well, that's normal. So, which is it, metabolic or respiratory? Respiratory, CO2 goes opposite of pH. So it is respiratory alkalosis. And then the why behind that, I already had it revealed, but the pH is going to be alkalytic because the lungs, it's a respiratory problem. The lungs are blowing off too much CO2, getting rid of too much of that acidic component and increasing the pH. And this, you can kind of see this in like someone who's hyperventilating in a panic or anxiety attack, but that's sort of the why of it. Going on to the next one. If we're kind of going too fast, you can always replay the video. Looking at the pH, 7.47. Well, that's close to 7.45, but it's still increased. So we know it's that. We know it's alkalosis based on our scale. PCO2, that's going to be 50. That's increased. Bicarb, 35. It's increased. Well, okay, what's going on here? Is it respiratory or is it metabolic? Well, just make it easy on yourself. Look back at these rules and remember that metabolic disorders, bicarbonate goes the same as the pH. So here, the pH is increased, the bicarbonate is increased, so it has to be metabolic. Are the CO2 and pH opposite? No, they're the same, so it can't be respiratory. So you know it has to be metabolic. But then, this value, it isn't normal. So what's happening here? Well, if the primary condition is metabolic, the body is going to try and compensate with the respiratory component. So this is not normal. So it's trying to compensate. So compensation is happening. But then is it like partial? Is it complete? What's going on here? Well, when these values aren't back to their normal, like within their normal reference range, at least as far as the pH is concerned, it's always going to be partial. I think for most of these problems, we probably won't get any where it's fully compensated. From what I've read, those are kind of complicated. So I think they kind of keep it pretty simple. And you can just realize, that's partially compensated because the CO2 is increased, but the pH still isn't back within the reference range. So what's going on here? Well, the pH is alkalytic because the kidneys, it's a metabolic problem, the kidneys are retaining too much bicarbonate, it's increasing that base component and raising the pH. And so the body is going to try and compensate with the respiratory component. And now it wants to do that by exhaling less and try and retain that acid component, but decrease the pH. So that's why this is so high. It's trying to retain more acid and sort of compensate for this metabolic component driving the basic component up. So just kind of think about it in these terms. Try and keep it simple. And we'll move on and practice and see a couple more of these in the next few problems. So number 4, pH, 7.32. Well, that's decreased. So we know it's acidic. The PCO2 is going to be 30. So that's decreased. And the bicarbonate is 15. So we know that is decreased.